Kampala doesn't need any more NGOs. Kampala is full to bursting with NGOs on every corner. But what we find is despite there being clinics and NGOs and government clinics available, women and children are still dropping through the gaps and not accessing the services even when they are available. What is missing is information. So women don't know what health services they need, they don't know what to demand, they don't know what to value. And they don't know about simple things that they can do at home to prevent their children and themselves from getting sick. This is really basic information that requires no new technology. We already know from public health research that these preventative strategies can save lives. But information alone is worthless if it doesn't lead to behaviour change. For example, if families hear about immunisation on a leaflet but don't understand it, don't trust it, and therefore don't use that information, then nothing has happened and nothing has changed. So in order for this information to lead to action, for instance, to change the way you go about looking after your child's health, obviously something that's really important to parents and something where it's potentially scary to make changes, you need to hear it from somebody within the community, somebody that you trust, someone who's maybe had kids themselves, who lives next door to you and can say, oh, this is what I did for my kid, this is what I did when I was pregnant. And you can learn it from a trusted source. So, it's no good just being told once or twice that you should get your kids immunised if you don't understand, okay, hang on, what is immunisation? Why is it important? Why do we do this? Why should I stick a needle in my baby? Do my neighbours do this immunisation thing? Do they stick needles in their babies? Because until you've got that bit and sort of that belief and community norms, then it's going to be very hard to change behaviour. So we have resources, and we know that people lack information about how to access those resources, what they need to do. And we also know that in order for them to use information well, it needs to come from trusted sources and needs to come from within their communities, and to be not an individual decision but a community-based decision that this is what we do for our children, this is what we do when we're pregnant. So how do we make that happen? How do we connect people to trusted sources of information so that they can use the information to lead to behaviour change? And how do we then link people to these existing healthcare resources so that poor people have access to all the things that they need to have a safe pregnancy and to start their kids well in life? So we know that community health solutions are vastly more effective and cost effective at preventing illness and death than clinics and buildings. Even though urban environments like Kampala are relatively rich in healthcare resources, they tend to be poor in the way of formal social infrastructures. The populations there tend to be more transient and less likely to be connected in with all their neighbours compared to a more rural setting. And this makes finding trusted resources, spreading information and finding a way to get inside the community that much more difficult. So we're working with an amazing partner called Crane. And Crane are a network of small organisations all across Kampala that work with children. These are local Ugandan organisations and churches based in these urban poor areas. So we're working with these churches as existing social institutions who already have trust and some penetrance into these communities, who are based there long term, who were there long before we came along and will be there long after we're gone.
There's no any other organization in the country which has a program that attracts more people who meet regularly than the church. Because for me, for the church here, we have to have people coming to church basically once a week. Every 7 days, you have hundreds of people meeting. So if you have any information for them, it is easy. I have that opportunity that every week, hundreds of my listeners get this information.
So loads of these churches are seeing these needs, we're seeing these healthcare needs there, and really not sure how they could engage, how they could best, within their congregations, impact their own communities. So it's been really exciting to come along and help them do a lot of what they already wanted to do and we're doing, and to give them just some more information and to help them think about how they can be most effective. So we've identified peer educators, peer leaders within their own urban poor communities. These peer educators are then working with their own churches and with their own host institutions within their slum community. They are going into people's houses to deliver this training, to share the knowledge that they have had already, to help people discuss why these messages are important, why they are true, how we can best adapt them for our own use in our own community.
One of the things I realize is that some of the women in these communities, mostly the women, know about some of this information. But the challenge is, they are not given an opportunity to ask questions. So having this conversation with this person, a one-to-one, you reach them in their homes, gives them an opportunity to ask questions about anything, then that in a way you're able to address their fears, because some of them have fears, for example, about family planning, about immunization. So then you have the opportunity to address those and help them understand how they work and where to get them.
We had a fantastic opportunity to actually see some of these peer educators in action. So they've been going into the homes of their neighbours, of their friends, asking their neighbours and friends to gather some of their friends, and they've been explaining some of the health information that they've been taught and they've had an opportunity to discuss and think about in their own training sessions, and they're now going out to share that with the community, to talk and discuss and teach, but also to learn and listen and help adapt these basic health messages that people in the community can use them, and gathering people together to talk more and get some good health gossip going. So I'm really excited about putting in this piece of work that helps to link up communities to information that they need, to give really good training to community members as to what they need to know about maternal and child health, to empower them to be able to share that with their neighbours and with their friends, and to link these people up to existing medical resources so that they know where to go when they need help, when they need medical attention, when they need to get preventative services as well. So this networked approach for basic community healthcare within an urban poor setting is going to get more important as the world's big cities just grow and grow, and as we're seeing a huge trend of urbanisation all across the world. We're so excited about this project because we think it will be able to address many of the barriers to health and to healthcare that people face in poor urban settings, both in Kampala but also in developing countries around the world. Finding these kinds of solutions will become increasingly important as the world becomes increasingly urban. We know that the world's urban population is expected to increase by 72% by 2050, and that most of this increase will be in the world's least developed countries. This project is an innovative, timely and important step towards finding solutions that address the pressing health needs of urban poor women and children in our rapidly changing world.